Welcome back to Maryland Health Today. My guest is Dr. David Eisenman. He's an otorhinolaryngologist at the University of Maryland Medical Center, and he's also on the faculty of the University of Maryland School of Medicine. And now, an otorhinolaryngologist is an ear, nose, and throat specialist, and your particular subspecialty area is hearing and hearing loss, but you also help people who have balance problems.
That's right.
How are balance problems connected to the ear?
Well, just like the ear senses sound through movement of the air, the ear senses our own movement. As we're walking down the street, or certainly as we're running or involved in sports, our head is constantly moving. But you need to be able to stay focused to be able to walk straight. Otherwise,
Sure.
you wouldn't be able to, you'd be bumping into things. So your eyes are moving up and down in your head, but they are able to stay focused on a fixed target. The way they're able to do that is that the ears sense the movement of your head and send a signal to keep your eyes stable. And they do the same thing to help keep your head stable and to help keep your body stable. So they are the motion sensor that senses the movement of our body and tells the other parts of our body, this is how I'm moving, this is what I need to do to keep stable in response to that movement.
Is vertigo the term for being out of balance? What's the definition of vertigo?
Vertigo is the abnormal sensation of movement. And since the ears are a motion sensor, if something is going wrong with the motion sensing system of the ear, you will have an abnormal perception of movement. It could either be feeling like you're moving even when you're sitting still, commonly a sensation of spinning, but it doesn't have to be spinning. It can be swaying back and forth, or it could be a sensation that other things around you are moving when in fact they are not.
Now, is it a similar feeling from when if you're crouching down and you stand up and suddenly you feel dizzy?
Usually that's more a feeling of what we would call lightheadedness or pre-syncope from getting a quick drop in the blood pressure to your head.
Right.
So vertigo is usually a little different than that, but in fact one of the most common causes of vertigo often occurs from people being bent over and standing up quickly or going down to bend over. That's how we can distinguish it. That movement of bending up and down stimulates the ears as well, and one of the common causes of vertigo does often present with vertigo in response to that. But you do have to distinguish that from the more common lightheadedness that people get from standing up quickly.
So vertigo, is that more of a persistent problem that people might have? It's not just one episode and it's gone?
Not necessarily. Some episodes, some people can have a single episode and that is it. Or they can have repeated small episodes. And then there are some people who have it as a very chronic problem. It is unusual to have the continuous sensation of spinning for more than a couple of days. If that were in fact the case, someone who had spinning that was ongoing for weeks, it's usually not the inner ear that is causing that problem. And that's a tip-off that it's not the inner ears. But it can come and go, or it can come and last for a few days and then go away. It can be there even when you're at rest, or it could be there only when you move about. And all of those little distinctions are what help us to figure out what's causing it.
Well, what are some of the causes of vertigo?
The most common cause of vertigo is something called benign positional vertigo, or benign paroxysmal positioning vertigo is the longer name. And that will commonly occur. People will be lying in bed and roll over to one side or the other. They often notice it first thing in the morning when they're ready to get out of bed, and they roll over and suddenly things start spinning. And it will last for about 30 seconds or so and then stop, and it may happen again. And that is due to displacement of some of the mineral crystals in the inner ear that sense motion.
So that would be an ear disease per se?
That would be an ear disease that would cause it. Another very common cause of vertigo is in fact not an ear disease, but a disease that affects the ear indirectly, and that is migraines. Migraines are very common. Up to 18 or 20% of women and maybe 9 or 10% of men suffer from migraines. Many of them have vertigo associated with it, often not even when they have a headache. It may have nothing to do with their migraine headaches, but they get dizziness or vertigo as an effect of the migraines as well.
Interesting, and that's even separate from the visual symptoms that someone might have
Yes.
without head pain.
Correct.
With the migraine.
Correct. Some people can get an aura of a migraine without having the headache. They can also get the dizziness without having the headache.
Now, you mentioned perhaps medicines as well could cause some vertigo.
Yeah.
And does that happen when, for example, elderly people might be taking a whole lot of medicines and they interact in a way that could cause dizziness?
Yeah, and that is a situation we encounter very often, and it's very tough to figure out which medication or what combination of medications may be causing the problem to try to figure out what we would need to stop. It could be as simple as a medication for blood pressure, making your blood pressure too low. Often in the elderly, there are multiple different factors that are interacting to cause imbalance or vertigo.
Well, how do you test someone for vertigo to kind of find out what specifically is causing them to feel this dizziness? And it must be a very uncomfortable thing.
It's not as bad as people think.
Okay.
It looks a little intimidating, but it's not terrible. The most important thing in the diagnosis is simply talking to the person to figure it out. But after that has been done and we've examined them, we can do testing to measure their eye movements.
And I guess this is an example.
In response to stimulation of the ear. So here we see someone being slowly spun to stimulate the inner ears, and then we have an infrared video that records their eye movements, and we see the eyes moving, and we can chart it electronically on a computer. We see how the eyes are moving in response to their body moving, and we see whether or not it's appropriate. And then we can also do tests such as this, where we simply are measuring to see how well can someone maintain their balance in response to abnormal visual cues or abnormal unsteady foot surfaces, and see whether or not they're still able to retain their balance. If your vision is impaired or what you're seeing is abnormal and you don't have a steady surface to stand on, the main system that's going to help you stay straight is your ears. And then we can see whether or not they're responding well.
And I guess there's some good treatments for vertigo, so you should definitely come to seek some help.
You definitely should. There are lots of treatments, and almost everybody who is complaining of chronic vertigo or imbalance, there's something we can do to help them.
That's good news. There's also a problem that you help people solve, and that's a facial paralysis or Bell's palsy.
Yes, Bell's palsy is a specific type of facial paralysis. The facial nerve travels through the ear to get from the brain out to the face. And many of the problems that affect it occur in the ear. Bell's palsy is just the sudden onset of a facial paralysis, usually within a few hours or a day, where one side of your face stops moving. It could be associated with pain. It could be associated with a sense of heaviness in the face. And that is the most common cause. Unfortunately, many people with Bell's palsy will get better even without any treatment, though there are some people who do require treatment, either medicine or even sometimes surgery, to give them the best chance of complete recovery.
When someone has this, is their face numb? Do they feel a numbness on the side that they're drooping?
They do have a sense of heaviness, but if you test them by pricking them lightly with something, in fact, the skin sensation is usually intact.
It must be a scary thing when that happens.
It's very scary for people. They usually think they have a tumor or something like that. Most often it's not. In fact, though, it's very important to distinguish that typical picture of Bell's palsy, a relatively sudden onset of facial paralysis that starts getting better pretty quickly, from a slowly progressive facial paralysis that develops over weeks or months or even years, which is not Bell's palsy and very commonly is caused by tumors. And unfortunately, we'll see people who have had a facial paralysis progressing for a long time, and they were told that there's nothing that can be done for it, or it won't get better or it will get better, when in fact they needed further testing to look into that to make sure that they don't have a tumor or to treat the underlying cause.
Right, but what would cause Bell's palsy?
We think the cause of the typical Bell's palsy is a viral infection.
Oh, I see.
And often it will occur after someone has a little cold, a simple upper respiratory infection, the sniffles, and a day or two after that they develop Bell's palsy. The facial nerve, as it travels through the ear, travels in a very narrow bony canal, a bony channel, so it doesn't have a lot of room to to move. And if you get a viral infection that hits the nerve and it swells up a little bit, that swelling creates pressure, which will lead to a facial paralysis.
I see. So when the infection clears and the channel opens up, that's when things get back to normal.
Correct. But if it was constricted for a long enough period of time and severely enough, the damage may already have been done, such that the infection clearing doesn't lead to complete recovery. That's why we want to try to find those people who are having it very severely to give them the additional treatment that they need to prevent long-term consequences of that problem.
So how long does it usually last before it clears up on its own if it's just due to an infection?
Usually people start getting better within a few weeks. Some people within a few days. Most people within 3 or 4 weeks. Though some people it takes a little bit longer. If somebody had a sudden onset of a facial paralysis and was not getting better within about 6 weeks, 4 to 6 weeks, we would want to look at that more closely to make sure there wasn't something else going on. Because with regular Bell's palsy, you should start getting better pretty soon.
And I guess a lot of people would come, though, before that, maybe see their doctor within a few days or a week just to check it out and see what's going on.
That's right. It's unusual for someone to live for 6 weeks without their face moving, without being curious as to what they could do. But it's really the doctors who need to know that we need to refer this person to a specialist to take care of this problem.
Good advice. Thank you very much for joining us on the program today.
It's my pleasure. Thank you for having me.
My guest has been Dr. David Eisenman. He's an otorhinolaryngologist at the University of Maryland Medical Center. He's also on the faculty of the University of Maryland School of Medicine. If you have any comments or questions about this program, please contact me by email at eblevitt@umm.edu. If you'd like to reach Dr. Eisenman or any other University of Maryland physician, call 1-800-492-5538 or visit the website where you'll find a great amount of health information. The address is www.umm.edu. Take good care of yourself. We'll see you next time for Maryland Health Today.